Finally, we have large intestine deficient cold. The difference between this pattern and damp cold in the large intestine is that this is a deficient pattern of imbalance, whereas damp cold in the large intestine is an excess pattern. The stools here will not be explosive, and there will not be cramping pain in the abdomen. Instead, the pain will be a dull nagging pain that is not alleviated by the passing of a stool. This is due to yang deficiency of the large intestine. Key symptoms: irregular bowel habits like loose stool or dry stool with symptoms of a deficient cold pattern. Clinical manifestations: rumbling intestines, dull abdominal pain, preference for warmth and pressure, lingering diarrhea or fecal incontinence, possibly even tenesmus, rectal or anal prolapse, aversion to cold and preference for warmth, cold body and limbs, fatigue, lack of strength, profuse and clear urine, constipation, a pale tongue with a white slippery coating, a deep and weak or deep and slow pulse. This pattern is caused by innate yang deficiency or by overconsumption of raw and cold foods or by chronic diseases or chronic diarrhea which damages yang qi. This pattern can arise due to excessive consumption of food and beverages that are cold or cooling, both energetically and thermally, or from prolonged exposure to climatic cold and repeated invasions of exogenous damp cold. Physical and sexual overexertion can also be involved in the generation of the underlying yang deficiency patterns. So large intestine deficiency cold, the etiology would be excessive consumption of cold and raw foods, prolonged exposure of the abdomen to cold weather, probable underlying spleen kidney yang deficiency. Possible presenting condition would be chronic enteritis, chronic dysentery. Signs and symptoms: loose stools resembling duck droppings, dull abdominal pain, pale urination, cold limbs, borborygmi, lower backache, poor appetite, aversion to cold. Now let's make a comparison between spleen stomach yang deficiency and large intestinal yang deficiency. In spleen stomach yang deficiency, the stools contain undigested food. There is poor appetite, oppression in the abdomen after eating. In large intestinal yang deficiency, the disease is in the lower rather than the middle burner, accompanied by diarrhea and borborygmi, and may have constipation rather than diarrhea. Pulse, deep and weak. Tongue is pale, thin tongue coating. Treatment principle: stop diarrhea and supplement qi and yang. Acupuncture treatment: stomach 25 to stop diarrhea and pain, stomach 36 to supplement spleen qi, bladder 20 to supplement spleen qi, Ren 12 to fortify the spleen, Ren 6 to supplement qi and stop chronic diarrhea, stomach 37 to stop chronic diarrhea, liver 13 to transform stasis, and bladder 25 to supplement the large intestine. We needle with supplementation and moxa. When there is large intestine deficiency cold, it is beneficial to consume warm, cooked, or baked food. It is advisable to eat foods that have a warming energy. Baked root vegetables, stews, soups, lamb, chicken, onions, and leeks are all examples of warming food. Spices that will be beneficial are cloves, cinnamon, ginger, basil, rosemary, and nutmeg. Thank you very much for your attention.